and I brought it with me tonight.
Please don't show that because it has my social security number in it. Thanks to my friends at the Florida Democrat Party and Ron Klein. So I hope you guys back there with his t-shirt, do y'all really support the fact that my social security number was mailed out into the public domain? I'd like to know that. Do you support an individual that did that? And you can laugh all you want, but let me tell you something. My life has been put in danger because of what Congressman Klein and the Florida Democrat Party did. And if you think it's a joke, then you need to wake up.
And we move on to also in this particular mail-out, there's a couple of allegations, and I'd like you to, if you would address these for us, because I know this is not, first off, I know this is not part of the issues, but...
No, it's very simple. I don't know anybody, okay? I had a top secret security compartmented information classification. That's the highest you can have in the United States Army. You don't get a security classification like that if you have financial issues. I still maintain a secret security clearance. And I tell you, if you look at the application for a security clearance, I have a clearance that even the President of the United States cannot obtain because of my background. Now, I am just like each and every one of you. Sometimes you get behind, sometimes you pay something late. But I didn't ask for a bailout. I took care of my responsibilities. And see, that's the part that their boss doesn't want to tell you. Because it's all about telling the half-measured truth. So I would put my character up against Congressman Ron Klein any day. Because in 2005, when he's making these allegations about me, from June of that year to the end of that year, I was in Kandahar, Afghanistan. And if you want to pick at my wife and my daughters who were back here trying to maintain my household, while I was over there protecting you, you're a sad individual. And you can take that back to Congressman Klein.
Now that we've dispensed with that, let's move on to the issues. And if you have a question on the issues, let's talk about it, because this is an important election for all of us. Yes. First off, tell us your name and then ask your question.
Sure. My name is Michael Rayner. I'm a resident here in Pompano Beach. You and I have met actually once before at Panera Bread, and we spoke about the military's policy on don't ask, don't tell. Mm-hmm. It's coming before the Senate, thankfully, for a vote this week. You opposed that. Mm-hmm. One of the first injured soldiers, I believe it was in Iraq, actually was a gay officer.
Okay.
And came back, I believe he's a double amputee, and served his nation proudly. There are men and women risking their lives on a daily basis for our nation to protect it, just as you did. Why should they also not have the right to serve in our nation's military and give back to this country?
Well, unfortunately, they do. They are serving. You just said that. And so I think what the thing is you're looking at is the military. The mission of the military is not to accommodate sexual behavior. Now, let me tell you something as a commander. Let me tell you something very simple. I fine people for not having a proper haircut. I kick people out because they couldn't run fast. I kick people out because they couldn't do push-ups. I kick people out because they were overweight. So, you know, the thing is, there was a compromise that was reached during the Clinton administration. And I stand by that compromise, and I think that's the best thing for the mission of the United States military. And so I appreciate any American that goes in and serves. But let me tell you something about me as a heterosexual in the military. I couldn't even walk in my uniform holding my wife's hand unless it was an official formal ceremony. So there are some rules and restrictions. You know how many years you can go to jail in the military for committing adultery? Do we have that in the civilian world? You can go to a military prison for 18 months for committing adultery. The United States military is a different society than the society that we have here. And I think the most important thing that we need to be focusing on, we've been in Afghanistan for 9 years, and we're still fighting major combat operations. That's where the focus should be, so that we don't have double amputees, being a heterosexual or gay, coming back to the United States of America.
What should we do about health care? There is a bill which has been passed. It's presently into law. Some people like it. Some people do not like it. What do you think should be done?
I think 64% of Americans said they didn't like it.
What should we do?
Well, the big thing is this. We do need reform of our healthcare system. There's no doubt about it. But turning it over to the government is not the thing that we should be doing. If you look at this healthcare law, 2,700 pages, first of all, 111 new government agencies. And what did we just talk about? How can you grow the economy of this country if you're creating 111 more government agencies? How can you grow the economy of this country if you're creating 11 more taxes? So the thing is, there are free market, free enterprise solutions that can help us to restore our healthcare system. The first thing is we have to look at the tort reform. All you have to do is look at Texas. When Texas instituted tort reform, California, Mississippi, that drove down the cost. And doctors are going there because they can have thriving practices. We don't have that here, and a lot of doctors, of course, are not just buying the malpractice insurance. The other thing is we have to have competition in the insurance realm. You know, the Commerce Clause does not allow the Congress to say to any American that you must go out and buy a certain private sector commodity. That is not where it is. But what we should be doing is we should be breaking down the state-by-state boundaries and restrictions that prevent us from being able to compete for the best possible insurance policy we can have for ourselves. If you go and you look at the Insurance Commission here in Florida, you are mandated for the programs that you have to buy instead of buying something that is beneficial to you. Now, the other thing that I think needs to happen is, you know, I'm a pretty healthy fellow, and I've not been to see a doctor since 2004 when I did my exit physical from the United States military. Why is it that at the end of the year, if I have unused insurance premium, because I'm not, you know, why is that not rolled over to the next year? Why is that not refunded back to me? Or why, out of the benevolence of my heart, I could say to my insurance provider, you know, I want you to find an American and provide that unused insurance to that person. See, we need to make sure that we are setting the conditions for the success of the individual American. That's the most important thing. Health savings accounts. We should be promoting health savings accounts, which means that that's less money that's going to the government, and that money is going for your routine medical instances. But what are we doing with health savings accounts now because of that law? We're taxing. So we're punishing people. We have to positively incentivize, and I think the American people will come around and do the right thing. Another thing that's very important about health care. Ladies and gentlemen, we have a problem in South Florida with illegal immigration. In this district, Jupiter and I think it's Lake Worth are becoming sanctuary cities. You look down south to Jackson Memorial and what the negative effects of illegal immigration on the hospital system there. And then up north to Martin County, exact same thing. We must understand that we cannot have these burdens being put on Americans for people that are here. The operative word is illegal. And we must protect our borders. So those are the things that we need to do. Now, can we just go in and repeal health care? It would take a 2/3 majority to do that because it would probably be a presidential veto. So I think what we need to do is look at the portions of that health care law, and Congress has the purse string, and it should not be appropriated. I believe that Americans with pre-existing conditions should be covered. So it's not about throwing the baby out with the bathwater, but we need to go through that bill and probably read it like some other people didn't do, and find the good parts of that bill and make sure that if it is in concert with the principles of this country, we should support it.
Speaking, Portia.
Well, I have a question about the government forcing everybody to buy insurance. And that's what they're counting on to pay for all of these 30 million people.
And they're going to fine you if you don't, so they try, yeah.
Right. Now, a lot of the states have filed suit against this. So where would this, if they win, about 30 states, I think.
Yeah, I think it's up to about 25 right now. And I mean, you would have to talk to the Attorney General about that, but you know, they are correct. I mean, you go into the Constitution, the Commerce Clause does not say that the federal government can force you as an American, as a private citizen, to go into a, you know, contractual agreement. The Commerce Clause talks about commerce with foreign nations, between states, and the Indian tribes. That's it. So we have to be very careful about that. Then, of course, you have the 10th Amendment, which a lot of people up there in the federal government are paying attention to because we are a federal system. So, you know, and we've got 4 government-run medical programs, being Medicaid, Medicare, the S-CHIP program, State Children Health Insurance Program, which, how many people know what that program is? Well, let me tell you an interesting thing about the State Children Health Insurance Program. Here's a program, great intentions, and this is where government gets outside their mandates. This program was intended for children, defined as 18 years of age, at or below the poverty level, to make sure that they had insurance coverage. But what happened in January of 2009 was all of a sudden this state children's health insurance program was redefined. All of a sudden the age of a child goes from 18 to 25. And the poverty level goes from 32,000 to 83,000. Now see, that is how you take